Good day, everyone. Welcome to today's episode entitled Unveiling Tapestry, a Journey Through Nursing History Taking. In the intricate tapestry of healthcare, nurses are the weavers, meticulously crafting the foundation of patient care. At the heart of their practice lies a timeless art, history taking. History taking is more than just a routine task. It is a sacred dialogue between caregiver and patient, a journey into the individual's past, present, and future health. The roots of nursing history taking trace back to Florence Nightingale, who emphasized the importance of understanding a patient's unique story to deliver holistic care. We have here Michaela to give us more insight about nursing history taking.
Hi everyone, I'm Michaela. So nursing history taking is the systematic process of collecting comprehensive information about the patient's health status, focusing on aspects relevant to nursing care. This includes gathering data about the patient's medical history, current symptoms, medications, allergies, lifestyle habits, and psychosocial factors. It is essential for nurses to assess patient needs, plan individualized care, and collaborate effectively with other healthcare professionals to promote optimal patient outcomes. It entails asking the patient for symptoms and perceptions regarding their health issues, functioning, and life process using direct, focused, and open-ended interview questions. Jumping to the importance of history taking in patient care.
Hi everyone, I have listed here various importance of nursing history taking in patient care. It includes building client trust, gathering significant information, identifying risk factors, detecting patterns and trends, effective diagnosis, encouraging collaborative decision making, and increasing safety for patients. The first one is building client trust. In order to establish rapport and a foundation of confidence, a healthcare provider must listen intently to the worries and experiences of their patients. It helps in forming the basis of a strong therapeutic experience for the patient, which is important for promoting healing and well-being. Gathering significant information. Information regarding the patient's past medical history, family history, social history, and lifestyle choices can all be found in their medical history. This all-encompassing image aids in comprehending the larger context of a patient's health. Next, we have to identify risk factors. Nursing history taking is significant as it helps the nurses for preventive care, early detection, tailored care planning, patient education, and interdisciplinary collaboration, ultimately contributing to the improved patient outcomes and overall well-being. Take this as an example. A family history of a certain illness or smoking habits, for example, can point to risk factors for future health issues. Detecting patterns and trends. A patient's medical history can eventually show patterns and trends that may indicate underlying issues. It provides efficient resource allocations and continuous quality improvement in healthcare settings. Nursing history taking can help to create an effective diagnosis. Accurate diagnosis is often preceded by a comprehensive history taking. This makes it possible to design a customized treatment plan that is tailored to the patient's requirements. Furthermore, it encourages a collaborative decision making. The patient can participate in joint decision making regarding their care plan with the healthcare provider by going over the results of the history taking. Last in the list, increasing safety for patients. A safer course of therapy is ensured by using information from the history collection to identify any allergies or avoid pharmaceutical responses. That's all for me. Let's move on to the next part.
Hi everyone, Mariel here. So now, as we have learned the definition of nursing history taking, we are now going to dive in to discuss the components of nursing history taking. The components of history taking includes biographic data, chief complaint, history of present illness, past medical history, family history, lifestyle pattern, and social data. Starting with biographic data, these are personal data that distinguishes one individual from another, such as patient's name, age, birthday, address, gender, marital status, educational attainment, occupation, religion, race, and ethnic group. Moving on with the chief complaint, this pertains to a patient's concise statement describing the information about his or her symptoms or reason for hospital admission, checkup, health consultation, or clinic visit. History of present illness is the patient's characteristics of complaint. Other symptoms manifested, aggravating factor, alleviating factor, and location or the site of distress. Past medical history. This one contains information on childhood illnesses, immunizations, allergy to drug, type of food, environment agents, medication records, previous hospitalizations, and surgery operations of the client. For family history, it includes the record of health information about a person and his or her close relatives, its risk factor, genetic predisposition to certain medical diseases that run in the family, such as their parents, siblings, and/or children, and cause of death of each deceased family member. Lifestyle pattern. This includes the day-to-day behaviors about the patient's diet, sleep, rest or relaxation pattern, activities of daily living, exercise, leisure, hobbies, and substance use such as tobacco, alcohol, and illicit drugs. Lastly, we have social data. This is the social information about the patient's relationships such as family relationships, social support system, communication pattern, coping patterns, home situation, strength, fear, spiritual beliefs, religious affiliation, and stress sources in the patient's life. Now, I'm passing the floor to Danica to explain how to prepare for the history-taking process.
The first in line for the preparation for nursing history taking is to gather information beforehand. And one way to gather information is by reviewing the patient's chart. This one is usually for the patients who already have a record in the said hospital. Understanding the patient's medical background by reviewing their detailed medical history will help you tailor your question and understand the context of their current concerns. You will be able to provide the highest level of care and tailor the treatment plan to their specific needs. The next one is to organize the environment. This includes providing the following. Privacy. By ensuring privacy, it can promote more effective communication between the nurse and patient, which is essential for quality of care, enhanced autonomy, and preventing economic harm, embarrassment, and discrimination. Make sure the patient has a private space or place where they feel comfortable talking openly about their health. Minimize distractions. To ensure no distractions during the conversation, try to turn off your phone as much as possible and shut down unnecessary computer apps. The last one is to prepare your equipment beforehand. Make sure you always have a pen, paper, and any necessary forms on hand so you can take notes. To ensure you address everything important, consider utilizing a template or checklist. Next, to organizing your environment is to introduce yourself and build a good relationship with the client. Here are some reminders for that. First things first, always remember that first impressions matter. Always greet your patient warmly with a smile and introduce yourself by name and title. For example, "Hi, I am Nurse Ryan." Next is to set a positive tone. Always speak with warmth and compassion to make the patients feel comfortable. Patients are more willing to trust a doctor or nurse when they get to feel valued or heard. Build a solid patient-provider connection, and guaranteeing treatment plan adherence depend on this trust. Lastly is active listening. This involves being attentive
and focusing on the speaker, understanding what is being said, and reflecting or seeking clarification. This keeps both patients and nurse engaged in the conversation. Use verbal cues like aha or I see to encourage them to share, as well as eye contact and regular nods to demonstrate your interest. Always consider the patient's age and cultural background. Speak clearly and concisely for older adults, and be mindful of cultural sensitivities when communicating. That's all for me. I will have Dinah to share with you the necessary skill for effective history taking.
Hi, Dinah here. For the necessary skills, I have here a list. Let's dive into it. Communication skills. This ensures the acquisition of accurate details, fosters trust, promotes active involvement from the patient, and contributes to the delivery of high-quality care, resulting in enhanced patient satisfaction and better outcomes. Next, we have medical knowledge. This allows nurses to contextualize the patient's symptoms in relation to other illnesses, risk factors, and medical issues. This understanding enables medical professionals to identify warning signals, assess the severity of symptoms, and determine whether more testing or treatment is necessary. Analytical thinking and problem solving. With these skills, healthcare providers can effectively navigate the complexities of patients' presentations, identify diagnostic clues, and adapt their approach to meet each patient's specific requirements or needs. Cultural competence and empathy. Cultural competence involves understanding and respecting patients' diversity, including their cultural backgrounds. Empathy is the ability to understand the patient's feelings demonstrated through emotional understanding, validation, and caring behaviors. Documentation skills. This one is essential for maintaining accurate and comprehensive patient medical records and contributing to clinical decision making. Professionalism and ethical. Ensuring a professional manner, reliability, and accountability while also securing confidentiality and obtaining informed consent from the patient.
That's all for this video. And to all of the aspiring nurses out there, I hope you learned something and realized the importance of practicing and mastering history-taking skill. That's all. Bye!